5 years after the start of COVID, we are getting a better idea of how it affected our children's learning. Matt Finn has a closer look at the pandemic's impact on education.
Reading, writing, and remote learning. The COVID-19 pandemic has had an immediate and permanent impact on our education system.
Everybody learned to use Zoom very quickly.
Sudden lockdowns across America in 2020 accelerated the adoption of virtual classrooms. Schools who may have been dabbling in the technology had to fully embrace online learning, ready or not.
We learned then what lack of digital infrastructure there was. We did not have technology infrastructure in a lot of the rural areas.
By fall 2021, almost all schools were back to offering in-person learning. Virginia Tech Associate Professor Donna Fortune says teachers had to adapt to hybrid classrooms, learning loss, and new tech.
After the pandemic, there's a lot of the textbooks. They created a lot of digital learning platforms for the students to use for math and reading and science. The days are long gone of standing up in front of a class for an hour and pouring knowledge into their head.
The new educational landscape highlighting industry issues, including teacher burnout and staffing shortages, disparities in access to technology and reliable internet, particularly in low-income areas, and learning loss, specifically in reading and math.
We might have lost some ground educationally, but it's going to look different for everybody, right? Some students are going to have felt more loss than others, but that's what teachers are good at, helping us understand how to meet the needs of all of those students.
In the classroom, educators were often battling a second epidemic. A recent Brookings survey revealing nearly 40% of teachers report more students are struggling with stress, depression, and anxiety than before the pandemic, fueled by isolation, uncertainty, and changes in routine.
Just last year, the American Surgeon General stated that there was an epidemic, there was a crisis within child and adolescent mental health, and it was a call to action for many people to make access to care, high quality care, or for kids and adolescents in ways that we had never done before.
As a result, schools are prioritizing students' mental health, many focusing on social emotional learning. With help, psychiatrist Chris Ivany says these struggles can be overcome.
When we do deliver care and support for those kids, the large majority of them get through those conditions successfully, and in many cases grow from those experiences.
That was Matt Finn reporting. The education industry is facing another shakeup with the dissolution of the Department of Education.